Welcome everyone to the Ideas 42 Academy Seminar Series. My name is Mitra Salosel and I'm the Director of Communications at Ideas 42. And on behalf of all of us on the team, thank you for tuning in to learn more about applying behavioral science to tough social problems. Today we're joined by two members of our economic justice team, Yates-Berg and Anthony Barrows, to discuss program delivery innovation during COVID-19 and beyond, starting with the ways the global pandemic has created new challenges for public benefits programs across the United States. Before I hand it off to Ali and Anthony, a small logistical matter for those of you who may be new to the Academy Seminar Series. We'll be taking questions throughout the presentation in the Zoom Q&A box, and then we will answer them live at the end of the presentation. So please feel free to drop your questions into the Q&A box as you have them. It's at the bottom of your screen on the right-hand side, and we'll answer them live all at once. Once again, it's at the bottom of your screen, Q&A box specifically, and we'll have time to answer everyone's questions. All right, without further ado, Ali, let me kick it over to you to get started.
Awesome. Thank you so much, Mitra. And thank you all for being here today. So as Mitra said, Anthony and I will be presenting on program delivery innovation during the pandemic. So today we'll draw examples from Ideas 42's work, as well as the broader government response in public benefit programs here in the US. We will be taking questions at the end of our presentation today, and we want this to feel engaging. So please do drop any questions you have, any thoughts you have into the Q&A box, because we would love to get to those. And so let's go ahead and dive right in. So a little bit about us to start. Hi, my name's Yates-Berg. I'm a vice president at Ideas 42, where I focus on our work in economic justice with Anthony. And my particular focus is on our work that looks at improving the health and well-being of families living on low incomes here in the US. I particularly focus on the WIC program. But in my career at Ideas 42, I've worked across a variety of different spheres of our work, from domestic health to post-secondary education success, as well as some work in city government. So I've touched a variety of different social problem and issue areas at Ideas 42. And I'll go ahead and let Anthony introduce himself as well.
Awesome. Thanks, Ali. And I hope you're all enjoying the kind of pre-COVID versus during COVID vision of me. I'm in my COVID caveman phase, so happy Thursday, everyone. But I'm a managing director here at Ideas 42, and I oversee the economic justice work that we do, which is broadly our domestic anti-poverty work. And like Ali, I've worked across a variety of spheres, including public benefits uptake and retention, but also post-secondary success, civic engagement, state and local government. And before coming to Ideas 42, my career was actually in child welfare. And so super excited to be working on some of those projects as well. So back to you, Ali.
Thanks, Anthony. And so since Anthony and I both represent our economic justice focus area at Ideas 42, we wanted to share our vision and our mission for the work that we do. So I won't read through these, but I wanted to pull out two themes in the vision and mission for you all. The first is that we believe that we can use behavioral science to help shift harmful and false narratives about poverty, and in doing this, create the political will to advance more effective and more generous social policy, and hopefully promote equity. And so a part of our presentation today will showcase how programs can implement practices that align with this vision. And then the second theme that I want to pull out for you is very central to the work that we do in our projects, which is around centering the voices of people with lived experience. And so that as well will be a theme of some of the examples we talk about today. So before we get into some of those examples, we wanted to get the juices flowing and do a series of activities with you all, both to, as I mentioned, get the juices flowing, but also to understand what your experience has been interfacing with some of the programs that we'll be talking about today. So please know that your answers in response to these activities on the polls is anonymous. So I can't can't see your answers, and we'll only present answers in aggregate. And so please be as open and honest as possible. So the first question is, how did you get your stimulus payment? The different choices: direct deposit, after applying through the IRS website, I didn't get it, I don't know, or I'm not eligible. So we'll give you a few moments to go ahead and insert your responses into the poll. If Moises, go ahead and tee that up for folks. Thanks. Right. Looks like we still have a few responses trickling in. Give you a few more moments. Let's see. I think we can go ahead and close the poll, Moises. Super interesting. So it looks like the majority of folks received their stimulus payment through direct deposit. So we'll talk a little bit more about how that was probably the ideal experience. And a few more than I thought actually submitted the application to be able to receive the stimulus payment. So I'm very interested in seeing how the take that Anthony and I will bring on that resonates with you all as well. A few folks that weren't eligible, a few folks don't know, and a few folks still haven't gotten it, which again, super interesting hearing more about your experience with this. So let's go ahead and tee up the next poll, which is, have you ever used SNAP, WIC, or another food assistance program? And I just want to be clear about some of the answer choices here. The first one, A, yes, before the pandemic, you had used one of these programs. B, yes, during the pandemic, you were found in need of accessing one of these programs and have been using it. C, never, or D, I don't know. So Moises, you can go ahead and tee up the poll. Give folks a little bit more time. All right. Few more seconds. All right. So Moises, I think we can go ahead and close the poll. Most of you have never used one of these food assistance programs, and a handful of you have used it, but before the pandemic. And so we'll talk a little bit about today, a little bit more about how these programs shifted during the pandemic to respond to the need to make them more accessible and also safer for participants. So we can go ahead and close out of that poll. Great, and then one more interactive activity for you all. What's one word that describes life in the pandemic for you? And I'm gonna ask Anthony if you can monitor the chat box. You guys can go ahead and drop your responses to this question into the chat box. And Anthony, if you don't mind reading out some of the responses, that would be super helpful.
We got a couple here coming in around uncertainty, and a couple coming in around being bored. We've got some that are centering around how this has clarified things for folks. So it's given a moment for reflection and clarifying the importance of things. Other folks are feeling limitations. So they're feeling cramped, they're feeling isolated, they're feeling confused or stressed. A lot of people feeling things like tiredness. So I think we're seeing a real panoply of experiences that we've heard about during the pandemic. Everything from a little more family time, a little less stress, more time for yourself, through something that's a little bit more unpleasant, but on the same wavelength. So feeling lazy or bored, all the way through feeling a lot more pressure and stress and chaos in people's lives. So we've got a good representation here.
Yeah, that's great and super interesting, the spectrum of experiences during the pandemic at what it raises for all of us. And certainly a lot of words within that response that I can relate to in my experience during the pandemic. And so with that, using those words as sort of a starting place to set the scene for our conversation today, I want to talk a little bit more about two broader contextual factors that have resulted from the pandemic and have really affected the experience of us out there in the world, and particularly us out there in the world who are accessing public benefit programs here in the US. So the first sort of broader contextual theme that I want to pull out is that, as you all pointed to, scarcity is at an all-time high right now. So I imagine many of you have been up against this during the pandemic, which was my reality as a mom of 2 under 4. So working from home with kids is an incredibly challenging situation. Your mental bandwidth is taxed as you're managing completing work deadlines, feeding your kids and caring for your kids, schooling your kids, as well as occasionally finding maybe a little bit of self-care in there for yourself. And so this is certainly its own context of scarcity. And we know that scarcity can be adaptive in the short term. So for things like work deadlines, as you get closer to that deadline, your mind is able to focus in with laser-like focus up in those last few minutes before you get that deadline completed. Your mind is able to focus to get that task done. But if you're constantly doing that, constantly experiencing scarcity over time, it's no longer adaptive. It's both dangerous and bad for our well-being. And so this is a classic example of an environment in which scarcity is certainly heightened. But what we know is that those experiencing chronic scarcity before the pandemic in the form of economic hardship have faced disproportionate harm given the pandemic's negative effects on our health as well as on the economy. So roughly 1 in 8 households right now doesn't have enough to eat. Many more struggle to receive healthful foods. And we know that the greatest impact has actually been on communities of color. So while nearly 1 in 3 households had trouble paying a usual household expense in the last 7 days, roughly half of Black and Latino families face the same challenge. And so the context of scarcity, while certainly dire for everyone, is particularly dire in communities already experiencing scarcity before the pandemic. And meanwhile, the second sort of broader contextual factor that I want to raise is that while you're facing this heightened scarcity, at the same time, everything feels new to everyone, right? And I think that descriptor of uncertain also plays into this here as well. Most of us haven't lived through a pandemic before. And in the pandemic, things that felt easy before, perhaps even enjoyable, like going grocery shopping, dropping the kids off at school, those things now feel harder. And in the context of public benefits, some people are accessing benefits for the first time. But like I said, everyone is new to accessing and administering benefits in a pandemic. And so there were already hassles involved in accessing these benefits. We would call those administrative burdens. But now there's also tremendous learning costs as you're learning to access these benefits now in the context of a pandemic with new processes and procedures for accessing them. And so all of this requires additional time, additional effort, additional attention, which again is just additionally taxing. And so now that we've sort of set the scene, I think both the activity that we did, as well as talking a little bit more about how scarcity has been exacerbated and the newness feeling of the pandemic, I want to talk a little bit more about some of the government response. So we'll talk quickly about what changed in some of these programs to help participants. And within that, we'll talk as well about things that were more behaviorally informed and maybe the good, things that maybe were less behaviorally informed, and things that were sometimes just flat out ugly in the way that the government response unfolded. And so the first thing that I want to pull out is that there is some broad agreement that the stimulus payments were a good start. Certainly arguments that it could have been more generous, and lots of arguments now that we need to get more stimulus payment out to folks, which I think we would generally agree with. But your stimulus payment experience, or your experience getting your stimulus payment, as some of you found out, maybe wasn't so straightforward. So if you filed your taxes and had a bank account ready, you received this nicely worded letter from our president letting you know that government is working well for you. It even includes this sentence, we hope this payment provides meaningful support to you during this period. And so, you know, this was sort of great. It was simple. It was automatically put into your bank account if you had filed your taxes and had that bank account ready. Generally a good experience. But for those of you who didn't file taxes in previous years, many didn't because they had too little money to, or set up a bank account, the experience felt quite different. So you had to go and apply through the IRS website. And this is a pretty poorly designed form, lots of small text, lots of jargon, and certainly less than welcoming language. And so you can sort of draw comparisons between the language in these two documents and the online portal. And it's easy to just focus on the form, right? This is clearly a very poorly designed form. But the larger question that a lot of us were asking was, why don't we have better information infrastructure in place to send out these payments more seamlessly, more quickly, and more accurately to everyone? And the second example that I want to talk about is around food assistance. So one of the silver linings, if there could be a silver lining of a pandemic, were the waivers that states could apply for their WIC and SNAP programs. And these waivers were great in that they did things like expand benefits and increase program flexibilities. They extended some certification windows and allowed for remote issuance, and allowed for participants to not have to come into the clinic in order to receive their benefits for WIC, for instance. And so these waivers did a lot of really great things. And there are some good arguments that these waivers should extend sort of beyond the declaration of emergency for the pandemic. But what's coming to light very clearly anecdotally, and some researchers are now confirming in the data, is that these programs are not going far enough to meet the high demand for food. And there are a lot of food pantries and food banks that are continuing to be overwhelmed over the course of the pandemic. And so that's exemplified in this picture. This is a picture of a food pantry in Irving, Texas, that illustrates just how intensely this demand is being felt by communities. And then thirdly, unemployment. So there's general agreement that unemployment insurance was generous. It was both extended and increased. And Anthony will talk a little bit more about this. Yet some states before COVID had intentionally designed their unemployment insurance process to fail. And this became spotlighted during the pandemic when the demand for unemployment insurance rose dramatically. And so Florida is a prime example of a state that designed its unemployment application to, or unemployment insurance application to intentionally not have people sign up for it. So this is a direct quote from the governor of Florida, Ron DeSantis. I think the goal for whoever designed it was, let's put as many kinds of pointless roadblocks along the way. So people just say, oh, the hell with it, I'm not going to do that. And so note the use of the term roadblocks. We would call that term, or roadblocks in this sense, administrative burdens or hassles designed intentionally to get people to not sign up. And this is certainly the ugly. We would actually use a very ugly word to describe this called sludge, the opposite of a nudge. So designing something in a way to get people to not access it is pure sludge, and certainly exemplary of a bad version of the way the government responded over the during the pandemic. So with that, I'm actually going to now turn it over to Anthony to talk us through where we go from here. So how do we design more effective and innovative program delivery during the pandemic and beyond, using takeaways from these programs as well as other examples from Ideas 42's work. And so with that, I'll go ahead and pass it to Anthony. And Anthony, I'll continue to steer slides for you as well.
Fantastic. Thanks, Allie. So if we can move to the next slide, that is the question that we're hoping to answer for you all today. Based on what we know about applied behavioral science, especially in the context of chronic scarcity, what can we do? How do we help people, especially in government programs, people relying on them, maintain their well-being during a really stressful time? And we've done some thinking about this already, which is going to inform some of the examples that I give you today. And I'm just going to drop into the chat here a link to our Poverty Interrupted paper, where you can dig in a lot more depth about our thinking on these topics. And so I won't belabor what the design principles are or all the recommendations, and instead leap right in on the next slide to the 3 takeaways that we've got about how to think about service delivery and how you can approach it in an innovative way during a global pandemic. And these are rooted in our thinking from Poverty Interrupted. So our first principle is to overserve rather than underserve. And we mean this in the context of public services, not your local bar, but the idea is not that dissimilar. So unfortunately, in our country, we've got a lot of narratives about social policy that say that only a certain selection of people deserve help from the government and deserve support. And so in order to make sure that only the deserving get things, we have to set up a lot of screening procedures and eligibility criteria to make sure that only the deserving are getting things, which makes it very difficult to serve a lot of people very quickly. And so our argument here is that in a moment like now, whatever your political persuasion is, if you care about the well-being of your neighbors, it's probably better to ignore all of those eligibility criteria and err on the side of giving the things that people need to more people rather than fewer. Which brings us to our second takeaway here, which is that when it's not possible to maybe do things automatically and universally and accept that you're going to overserve people with a service, you should cut the costs that are associated with receiving a service or a benefit as much as you possibly can. So if you really can't just give everyone a $1,200 check and you need them to do some kind of thing to apply for a service or benefit, make sure that that process is as easy as you can possibly make it, because now's not the time to be erecting the kind of roadblocks or putting the kind of sludge that Allie was just talking about into these systems and processes. And then a final takeaway here, which is going to operate independently of which one of these first 2 you're trying to follow, is to consider how things like people's identity play into the way that they interact with any of these programs or services. And in particular, to think about how you can do things to mitigate stigma that might be attached to any of these programs or services, to ensure that people are having a dignified experience that enhances their autonomy as they get the help that they need to survive and thrive, even in the midst of a global virus. Okay, so then what does this look like concretely? I'm going to walk you through each of these takeaways in order. And so taking the overserved rather than underserved first, there's kind of 2 pieces that I would point to here. The first of which is automate things. So if at all possible, make sure that people are getting access to a benefit or service or program automatically. Don't make them jump through a bunch of hoops to apply. And then the second major takeaway is to think long and hard about whether you need any eligibility criteria to begin with. And maybe think about doing something like presumptive eligibility if you have to do some kind of eligibility screen, where you assume that people need a thing and you can work on the back end to figure out if that's actually true later. So I'll give you a couple concrete examples. Let's move to the next slide. So if we think about the kind of automated transfers of either cash or near cash benefits that we've seen in the last 9 months, the first one, let's pull that one up, is the stimulus payments. And I saw in the chat that someone mentioned that they got an automatically generated check sent to them, not a direct deposit, which is what we see on the screen here. And if you think about the stimulus payment from the point of a deficit hawk who says, hey, look, there's lots of people, and I would include myself in this, that didn't actually need that $1,200 per person sent to them. You know, they've got a very comfortable income. It wasn't interrupted in any way by the virus. You know, that's an interesting problem. But the fact is that lots of people who last year may have had a really comfortable income may not have one now. And so again, with the principle of over-serving people, it's better to put this money out, let people spend it if they need it. And if you're really that concerned about people who don't need the money not spending it, we can devise ways to maybe claw it back through taxation if people have over a certain income at the beginning of this coming year. And then if we can't automate things like this, let's move to the next element of this slide. There's another way to think about this. So if you look at this map, this is the distribution of pandemic EBT. And the folks that are in blue, the states that are in blue here, were ones that did direct issuance. And so pandemic EBT was important in a variety of ways, but one of the things that it did was to replace free and reduced lunch that made affordable and healthy food available to children in school. And with so many children being out of school, they were missing out on this really important resource for their nutrition. And so pandemic EBT was able to replace some of that with some resources in the form of a SNAP-like disbursement. And for students who were free and eligible lunch at school and or who already had SNAP or TANF, the states in blue were doing direct issuances of this resource. And in others, people either had to apply or there were some other procedures to do it. So really thinking long and hard about eligibility is important. And in a place like New York City, there's actually district-wide findings of eligibility for things like free and reduced lunch if you live in districts where there's a high enough proportion of people with a low enough income to qualify. And so everyone in New York City that has a child in school got some pandemic EBT support. And we think it's better to send some of that EBT to people who maybe don't need it to make sure that everyone that does actually gets the chance to use it. Okay, so let's move on to our next takeaway, which is to make sure that when you can't do things like automate or automatically distribute benefits and services, or to make eligibility basically non-existent, that you're making it easy for people to do whatever processes that they need to gain access to things. So 2 concrete things to think about here. First, because you need to communicate with people what the eligibility criteria or the processes are that they have to follow, the first thing that you should be doing is making sure that whatever communications you're putting out into the world are clear and actionable. So if you've got a website, if you're sending emails, if you're sending text messages, letters, postcards, you got to make sure that those things are easy to scan, that the call to action is front and center, and that it's something that people can act on in the moment whenever they get it as easy as humanly possible. And then the second thing to consider here in terms of cutting the cost, if we can move on to the next element of this slide, is to cut the strings, which in essence says that you should give people stuff without expecting them to have to meet a lot of conditions or do a lot of extra things in order to gain access. So let's move to the next slide, if you would. Now, this is an example from a large US city, which shall remain nameless, where we were giving them advice about how to help people maintain access to cash benefits that they were getting. And because COVID shut down the in-person centers where these people needed to go to maintain their access, we needed to do that thing that Ali was suggesting earlier, which is help people navigate a new, complex, and unexpected environment with all kinds of different expectations. And so this communication was designed to help people understand what it was they had to do to maintain their cash assistance and how things have changed. So if we can go through the next 3 clicks, these are the techniques that the team working with this nameless city chose to do. So the first thing was to make it clear that they should act now in order to get a full year extension, because people actually had the option to not do anything and they would continue to get some months of help. But we wanted to softly default people into acting now in order to get maximal help. The second thing that this team did was to leverage up people's motivation by making it super clear what the benefits would be, getting that year-long extension. And then the final thing, which is really on point with this takeaway, is to make it super clear what they've got to do and to make it easy to take action on. So you can click right into the thing that people need to do right from this email. All right, so let's move to the next piece, which is about cutting strings. And so, we see a lot of strings attached to a lot of benefits programs. Some of them seem reasonable on their face, some of them don't. Some of the more egregious ones that I think about include things like work requirements being attached to Medicaid programs, or drug testing being attached to things like SNAP. And we think that those are terrible policy choices, both from a behavioral perspective and from a moral one. But one thing that we think went well during the pandemic was actually a kind of no strings attached disbursement for people that managed to claim unemployment. So if we can move forward for 1 slide, you all may remember seeing some of these graphs, the really upsetting amount of people that were forced into not working and having to claim unemployment. We rarely see slopes like that in our economy. And if we can click forward 1 more, the thing that was important about this is that through the federal legislation around amping up our unemployment assistance for the people that managed to successfully make these claims, which over time ended up being most people that needed to, they got one of the most generous social policy disbursements of our lifetime, which was $600 per week for the duration of the time that they were on unemployment, which lasted from early April through late July. And they didn't have to prove that they had all kinds of extra income that made them deserve having more money. If you were getting unemployment, you were getting this extra cash. And some people may critique this as a demotivating factor in terms of employment. But the facts of the matter are that if we can avoid people being out and about, having to go to work to make a living, it's probably the best thing for our health collectively. And if we can click forward 1 more time, there's also plenty of evidence, both from the pandemic now, but also from previous research that tells us that people are actually intrinsically motivated to work, and that even something like $600 a week is not going to, in the long run, depress people's labor market participation. So for any number of reasons, it makes sense to have these no strings attached kinds of distributions of important resources, particularly during a pandemic that's threatening all of our lives. Okay, so last takeaway is really about the issues of identity and stigma, and making sure that whenever we're offering programs, benefits, and services, we're taking these things into account. And yeah, sorry, keep going, Ali. I must be running behind. You're trying to rush me. So here are the two principles that we want you to think about in regards to these identity issues. So the first of which is that we should always be thinking about how to leverage positive identities when we're framing what a program is, who it's designed for, who ought to be using it, et cetera. And making sure, because we all have multifaceted identities. I'm a person that works at Ideas 42, but I'm also a person that holds a master's degree and a parent. And so when you're asking someone to do a thing, you should be thinking about the various facets of their identity and making sure that you're priming the ones that are positive and that are likely to help people follow through on some kind of action. And then the second piece is one that I just can't emphasize enough, which is to treat families as the experts that they are on their own lived experience and their own needs, and to make sure that as you design programs, policies, and services, that you're leveraging that expertise and authentically inviting constituents and beneficiaries into the process of building something new or changing something that exists, and giving them meaningful autonomy and decision-making power over how those changes or how those new programs are designed. So let's consider a couple examples. The first thing that I'll show you here is around some guidance that our Behavioral Design Center here in New York City that works with nonprofits in the 5 boroughs did with community food advocates. So we mentioned pandemic EBT earlier. So this is the automatically dispersed food assistance that went out to public school students and others here in New York City. But it was new. This wasn't just an expansion of SNAP. Some people had to get new cards, and they'd never used these pandemic EBT cards or any other EBT card in the past. But people wanted to be sure that folks knew how to access them. And so we made a few choices here to help people figure out how to use them, much of which landed on positive identities that we knew we could activate. So the first of which on the right is activating the family identity. So making sure that people were thinking about the fact that a lot of students are actually like the cultural brokers, the literal or figurative translators for things like this to their families. So this was directed at students, knowing that they were the first line of defense to translate this information up to the family. And then the second piece that I want to note is that we were trying to prime deservedness, that this was their money, their resources, they deserved it, they needed to use it, everyone was getting it, to make sure that there wasn't, well, not that there wasn't any, but that we would reduce the amount of stigma that would be attached to using these things. Because we know that an EBT card, for better or worse, does carry stigma in today's society. Okay, so let's move on to the next slide. And in this case, I just want to pose a question to all of you and have you think about it for a moment before we move to the next set of slides, which is to ask you to consider how things would look differently if we actually treated families as the experts that they are on their own lives and their own needs. And if you could imagine for your own self, how would something like the DMV look different if you, the user of the DMV, got to design the look and feel of it, or its business hours or locations, or the way that some of the forms look? If you've ever felt irritated at a government bureaucracy or any other kind of bureaucracy, an insurance company or anything else, then you can understand how important it is to center the lived experience and the self-identified needs of people when you're designing something to serve people. And that's no different for people that are trying to access programs like WIC or SNAP or Medicaid, CHIP programs, et cetera. And so unfortunately, what I have for you here isn't a great example of how this works when it happens properly, but instead what happens when we do the opposite, when we don't think about engaging families in designing a process, and instead design one that's maybe, possibly, probably 100% designed to keep them out. And in this case, this is the announcement and later implementation of the new public charge rule. And so some colleagues on the economic justice team at Ideas 42 took a look at what happened just from the announcement of the public charge rule. So not the enactment, this isn't the result of the policy going into effect, but just from the administration saying out loud, hey, we're gonna change a bunch of rules around who is eligible for citizenship. And if you're accessing programs like WIC, like SNAP, like Medicaid, then maybe that makes you deportable, and maybe that makes you ineligible to become naturalized. And so this is independent of whether the children in the home are eligible for this. What we found, if you can click ahead one more, is that 260,000, so almost a quarter or more than 250,000 children lost their Medicaid coverage in a pandemic because of the threat to a parent's immigration status that this public charge rule announcement created. So that's what happens when you don't center the needs of families when you're designing programs. And so imagine the power of doing the opposite. And that's kind of what I'll leave you with the concluding thoughts before we move on, is to remember that in a pandemic, we're all neighbors, we're all living together and relying on each other for our well-being. And one of the things that our economic justice portfolio is working on is trying to understand how we can use behavioral science to change some of these pervasive social narratives that tell us that there's some people in our society that don't deserve help. And so please be in touch with us if that's of interest to you. We've got some publications, if we can move forward to the next slide, that may be of interest to you around our COVID response, not just here in the domestic anti-poverty space, but also globally and on topics like health and civic engagement as well. You can find them at this link on the screen here. And I guess I will just pause there. If you need to get in touch, here's our emails. And I think that we are at 15 minutes to the end of the hour, so happy to start taking questions.
Great. Thank you so much, Anthony and Allie. Want to reiterate, everyone, please drop your questions into the Q&A box, and we do have over 15 minutes to answer them. While people are thinking and putting their thoughts into words, we do have one quick question. I can't remember off the top of my head if this was in the health affairs paper or not, but do you happen to have the numbers on how many people lost WIC as a result of the public charge announcement?
I don't know them off the top of my head, but they are in the health affairs paper, and you can find that paper on our website. So I can quickly go over and grab the link to the blog post that links directly to it.
And that is a great reminder that I can share also while people are formulating their questions. We will be sharing a recording of this session and emailing it to everybody who RSVP'd. And we're happy to send over some links of some of these resources in that email as well, so that it's easy to find everything in one place. And that includes the Poverty Interrupted paper that Anthony mentioned, the COVID resources, and we can also share the health affairs paper. So lots of reading material. And I don't see any questions in at the moment. So we'll just give it a few more seconds for people to type those in. Oh, there we go. We've got one from Larry Rosenberger, who asks, why not make it easy for people who don't need financial support to send the amount that they received, I'm assuming in the stimulus check, to send to a nonprofit without tax implications?
Yeah, it's a great question. And I think that it is the same reason that Allie mentioned earlier, which is that we don't have a very robust, centralized financial and other information technology infrastructure. So yeah, I totally agree. It would be really nice if I could have more easily said, at some point with a forced choice moment, actually like take these, whatever it was, $2,900 and send them over to the Red Cross or something. That would be nice. But A, the infrastructure doesn't exist, and B, it's both complicated, expensive, and outside of the current political will, I think, at the federal level to do things like that.
I would just add that I know this is a busy fundraising time of year for a lot of nonprofits. So you can envision a world where a nonprofit maybe designs some kind of outreach communication saying, still haven't spent that money. Like, here's a great way for you to put that money to good use. And, here are the ways we're responding to the pandemic, et cetera. So you can envision a world where, maybe that is an exact approach a nonprofit takes to do some interesting fundraising at the end of the year.
Great. We have another question, this time from Zell Allison Crawford. So as it pertains to scarcity, what does Ideas 42 think about what really makes the difference between adaptive and maladaptive response? And, are you thinking differently during a global pandemic specifically, or are we just talking about toxic stress in general? And she qualified this by saying the question is really about resilience, but hesitate to use the term without further definition.
I'll take a first stab at that, and then Allie, you should jump in too. I think the first thing that I'll reflect on is that adaptive versus maladaptive is a charged dichotomy, right? So, as a former social worker, I would often try to correct people when they would talk about young people in the foster care system in particular having, maladaptive responses, because I think all responses are really adaptive to the environment that you're in typically. And so, things that could be maladaptive in, the wider world of like families that raise you gently in a middle-class environment might not keep you alive in certain environments as a child. So like the thing that looks maladaptive in the suburbs in the two-family nuclear home maybe look a lot different if you're, a teenager in a group home or something. So I guess I would want to like dig in on like how are we defining adaptive versus maladaptive? And I don't feel prepared to answer that exactly, but Allie, what are you thinking?
Yeah, I think this is really interesting because of what we know that scarcity can promote at times, like additional creativity. I think there was a recent article, I want to say it was in the New Yorker, but I forget, about a famous restaurateur that sort of in moments of scarcity with few ingredients was able to cultivate these like beautiful dishes, right? And so similar to like the experience you have like going up to a work deadline and having suddenly those moments of scarcity helping you focus in to get that done and sort of combat further procrastination. I think, that is an instance where, scarcity can promote this creativity, resourcefulness, honed in attention. But I think if you're constantly in instances where you're doing that, right, and I think that's when you sort of draw the distinctions. It's great that families experience economic hardship can be so resourceful in moments, right? But like expecting them to constantly do that and operate in contexts of scarcity, I think is when it starts to linger into problematic. And so, yeah, I think it's an interesting question. And it's like, when does one become the other? I don't know that I have a clear answer, except that to Anthony's point, I think the context around it really matters, and the outcomes that are resulting also really matter. So, yeah, not sure if that was super helpful, but that's where my mind goes.
I would just add one more thing, which is that, when you're in a context where people are scarce on a key resource, and you're seeing, let's call it suboptimal outcomes from their choices and actions, then one surefire first step that you can take is to try to relieve the scarcity, either by giving people more of the resources that they lack, or by asking them to, spend less of their financial, temporal, or cognitive resources to get access to the things that they need. So I think that's a pretty good, first bet if you're trying to solve some of those problems.
Great, thanks to you both for that discussion. We don't have any more questions in the queue at the moment. So anyone with a burning question that they've been holding on to or thinking, should I ask it or not? We've got some time, so please, feel free to drop it into the Q&A box. And while you are thinking about those, I have to make my customary plug for upcoming Ideas 42 Academy programming. If you are interested in learning more about our approach to solving problems across a range of issues and applying behavioral science in your own work, we do offer crash courses in behavioral science. The next one, and it will be entirely remote. Of course, the next one starts February 1st, and you can find more information about that and how to register at ideas42.org/academy. And as we add more programming to our seminar series in 2021, we're looking to launch our schedule soon. You can also find all of that at the same link, ideas42.org/academy. Great, I think that plug did spur some people into asking some questions. So the next question is, can you share some thoughts about minimum income idea and any tests around that?
Yeah, we're big believers in unconditional cash transfers. And I think that there's lots of really interesting debates to be had around, what constitutes a sufficient amount, like what constitutes the basic part of a basic income, and how much universality there ought to be versus means testing. But in general, like this is a big, area that we are proponents of. And we, as an organization, have done a reasonably large amount of work on cash transfers outside of the US, and are always on the lookout for people that might want to try piloting these things, especially bringing in some of the behavioral science aspects of, you know, if we label it in a certain way, does it encourage certain behaviors? Or if we add on some nudges and reminders, can it help people, you know, continue on toward a goal that they've set? The short answer is, yeah, basic incomes are great in general. And if any of you have an interest in talking about them specifically, feel free to be in touch.
I would just +1 that exact response. Thanks, Anthony.
Great. Next question, any tips for engaging state Medicaid agencies in how simplifying SNAP or TANF benefits can improve health outcomes?
Yeah, so we've done a ton of work around SNAP and WIC, less so on TANF. And what I would say is that, you know, there's a ton of resources that we could point your way around what works and how, in terms of getting people to recertify and stay on the rolls. You know, TANF is a lot more complicated given the lifetime eligibility rules and so forth. But SNAP and WIC are different, and we've got a lot of ideas and evidence around what works to keep people in the programs. And what we try to do to engage state agencies, local agencies, county agencies that are administering these things is to help them understand the theory of change. So in essence, like, if you don't keep people on the rolls, then all of this great research from the public health world and elsewhere that says access to WIC increases birth weight, but also later in life education and mental health, like, none of that actually happens if people aren't getting access to the food supplementation and the educational portions of it. So we really try to point to good existing research out there around the longitudinal benefits of these kinds of programs, and then point to the fact that there can be a ton of churn around things like SNAP, and then help them understand how there's a ton of evidence for improving communication leading to higher rates of retention.
And I think what I would add to that is, like, now is the time to do these things with these waivers for WIC and SNAP in particular, and these increased program flexibilities. I would just say, I think now is the time to be pushing on some of these conversations. And so, yeah, to the extent that we can be helpful with equipping you with the research to go into these conversations, we'd be happy to help. And I think we have a lot within the work that we've done within WIC in particular around ways that we can help sort of advance those conversations so that you have what you need to make your case. So feel free to reach out.
Great. So there is one question left that actually returns back to a little bit of the conversation around, you know, adaptive versus maladaptive response, and like trying to get at the heart of what resilience is. Do you have a working definition of resilience these days that either one of you is using, that you would care to share with the group?
Allie?
I can't say that I do. And I'm sorry I can't be more helpful on this. I don't know if it's the same person asking this question, but it is. Yeah, I don't think that I do. And I think a lot of our work has focused on creating contexts in which families don't have to be thinking about ways to, you know, be resilient and, you know, creating contexts in which there isn't as much scarcity. I think that's often our focus, not so much like within a context helping families sort of adapt to that scarcity in a way. So I guess I spend less time thinking about this, but I am interested. And I don't know, Anthony, do you have a better, more direct response to that question?
It's a complicated topic. So I've thought over my career a lot about resilience from the context of child welfare. And so in that context, resilience is, as Allie was suggesting, the ability to persevere and thrive in the face of trauma and injury. And so that's how I understand resilience. And you can adapt that to kind of different contexts and settings, but that's in essence what it is. That, you know, are you able to withstand kind of pressures and stimuli that would otherwise be harmful? And so the question that is often asked is about how you can create resilience in people. And I think Allie's right to suggest that it would be better if we can think about how to create environments that obviate the need for people to be resilient, which doesn't mean that we shouldn't think about the protective factors that we know are correlated with people being resilient in the face of trauma and injury, which include for children things like having caring adults and, you know, safe environment, and, you know, things like enough to eat and so on and so forth. So that's a very long-winded and complicated answer, but that's how I would answer it.
All right. Okay, thank you both for the discussion on this. And thank you to everyone for your thoughtful questions and for participating in the discussion. I think with 2 minutes left in the hour, we can probably close it here. But like I mentioned earlier, you know, we can share all of the resources that Allie and Anthony mentioned during the presentation, as well as a recording of this presentation. And if you have any lingering questions, or you think of any after the fact, or you just want to talk more, please feel free to reach out directly to either Allie or Anthony or both, and I know that they would be happy to speak with you more about this important topic. So with that, thank you very much, Allie and Anthony, for sharing your thoughts and your insights, and for what is supported by some comments from several participants that not all the participants can see was an objectively excellent presentation. So thank you so much. And thank you all for joining us and spending some time with us at the Ideas 42 Academy.